Hey everyone, and welcome back to my channel. So today I'm going to talk about informed consent. Now I'm going to talk about this from the transsexual male side, so female to male transition. I think that this is very important since everybody wants to talk about starting to medically transition children, and I want to talk about an informed consent paper that adults have to sign because all the facts are on here, and I'm not really sure why we would be giving this to children, and you'll understand that after I read this, because this is what I had to sign. This is what adults have to sign in order to go on testosterone. So I just think it's super important. So this is from Cornell Health, the informed consent paper. Now I'll link that in the video so everybody can see this if they want to. But here we go. Now I'm not gonna read the entire paper. I am going to read the most important parts and the parts that you need to acknowledge. And I want this to be informational for parents, for people who do want to transition, but just to show you that being on HRT, there's nothing about HRT that's reversible. There are some things that are, but you undergo permanent changes when going on testosterone or going on HRT. And it states that right in this paperwork, right up here in the beginning. So here we go. The expected effects of testosterone therapy. Changes that will be permanent. They will not go away even if you decide to stop testosterone treatment. Number 1, the pitch of your voice becomes deeper. This is a permanent, irreversible change. You cannot change it. Number 2, increased growth, thickening, and darkening of hair on the body. Once again, permanent. Number 3, growth of facial hair. Once again, permanent. You might be able to shave it off, but it's permanent growth. Number 4, possible hair loss at the temples and crown of the head with possible complete baldness, which is also known as male pattern baldness. Permanent. Number 5, increase of the size of the clitoris, and also known as bottom growth in the community. A lot of people don't talk about that. I'm going to actually do a separate video about that myself. Now, those were all permanent changes. All right, so here we go. Changes that are not permanent and will likely reverse if testosterone treatment is stopped. I want to be clear. The language right here says, and will likely reverse. So they're not even sure. It's obvious in the paperwork, but let's read them. Number 1, menstrual periods will stop, usually within a few months of starting testosterone. So most likely, if you go off testosterone, you would get your periods back. That's what they're saying. Most likely. Number 2, possible weight gain. If you gain weight, this fat will tend to go back to the abdomen and midsection rather than the buttocks, hips, and thighs, making the body look more masculine. That is reversible. And that's also known as weight redistribution in the community. Number 3, increased muscle mass and upper body strength. So that can be reversible. Number 4, possible feeling of more physical energy. Number 5, skin changes, including acne that may be severe. Number 6, increased sex drive. And number 7, changes in mood or thinking may occur. You may find that you have a decreased emotional reaction to things and possible increased feelings of anger or aggression. Some persons find that the mental health improves after starting hormone therapy. The effects of hormones on the brain are not fully understood. I'm going to read that again. The effects of hormones on the brain are not fully understood. And we want to give this to children? It makes no sense. All right. Let's go on. So the risks and possible side effects of testosterone therapy. Possible loss of fertility. You might not be able to get pregnant after being on testosterone therapy for some time. How long this might take to be permanent and a permanent effect is unknown. Some persons choose to harvest and bake eggs before taking testosterone therapy. Testosterone is not a reliable birth control. However, even if your periods stop, you could get pregnant. If you are having penetrative sex with a natal male partner, you should discuss using some form of birth control with your medical provider. If you do get pregnant while taking testosterone, the high levels of testosterone in your system may cause harm and even death to the developing fetus. Yeah, I think that was an important one there. Other effects of testosterone on the ovaries and developing eggs are fully not known. Once again, a lot of not known in here, and we want to give this to kids. Some trans men, after being on testosterone for a number of months, may develop pelvic pain. Often this will go away after some time, but it may persist. The cause of this is not known. I'm sorry I'm laughing right now, but the reason why is because this is actually known what this is. It's known in the community as vaginal atrophy. It's just not talked about a lot in the community. I'm also going to talk about that in a different video, but it's called vaginal atrophy, and it actually usually does not get better. It gets worse over time, and you usually have to have a prescription for something to help you with that, or a lot of trans men get a hysterectomy. So, but I'll talk about that in another video. The lining of the cervix and walls of the vagina may become more dry and fragile. This may cause irritation and discomfort. It may also make you more susceptible to STDs and HIV if you have unprotected sex. The effects of the risks of breast, uterine, and ovarian cancer are not known. I'm going to read that one again. The effects on the risk of breast, uterine, and ovarian cancer are not known. And yet, we want to give this to children. Possible changes in cholesterol, higher blood pressure, and other changes to the body that might lead to an increased risk of cardiovascular disease, heart attacks, strokes, and blockages in the arteries. Possible changes in the body that might increase the risk of developing diabetes. Increased appetite and increased weight gain from both muscle and fat. Increased risk of sleep apnea, breathing problems while you are sleeping. Possible or abnormalities in blood tests for liver, possible worsening of damage to the liver from other causes. An increase in the hemoglobin and hematocrit, the number of red blood cells. If this increases to higher levels than as normal in males, it may cause problems with circulation, such as blood clots, strokes, and heart attacks, and heart attacks. I've actually spoke to that. That happened to me. Increased sweating. That's definitely what happens. Weakening of tendons and increased risk of injury. Possible worsening or triggering of headaches and migraines. Possible increase in frustration, irritability, and anger. Possible increased aggression and worsening impulse control. Possible worsening of bipolar disorder, schizophrenia, and psychotic disorders or other unstable moods. I want to read that one again because I feel like that's very important. Possible worsening of bipolar disorder, schizophrenia, and psychotic disorders or other unstable moods. And yet, we want to give this to children. We want to start to medicalize children. Now, I didn't even read the whole thing, and like I said, I'll post this, but this is something that I had assigned. And mine was a little different, a little longer, because I signed one in 2017. But just reading that for you now, are you sitting there wondering, why would people want to start giving this to children when there's all these side effects? Why do we want to start transitioning children who aren't old enough to make the choice to transition? They don't know that. So why are we allowing them to put all these risks onto their healthy bodies? Why don't we allow them to grow up and make that decision themselves when they're an adult? In my personal opinion, I don't even think people should transition until after the age of 25, because it's already been proven as a scientific fact that the brain does not stop developing until the age of 25. So to me, since we don't know the long-term risk of the brain while taking hormones, we don't know long-term risk about many things while taking hormones, why would you want to risk that? So personally, I don't even think you should transition until after 25. That's my personal opinion. But it's scary just reading this, and this is something that they want to start giving to children. Like I said, this is scary for me. It's dangerous for me to transition. This is something I have to sign, and we want parents and children to know and understand this and agree to this. Children can't agree to what I just said. Children aren't going to understand half of what I just said. And if you're not sure, play that for your children and see if they just understood it, because they probably didn't. So just do your research. Please do your research. Start doing your own research. It's all out there. I'll link this informed consent in this video. See you in the next one.